Diabetes Family Education: Understanding Screening for Long-Term Complications for Children and Adolescents Living with Type 1 Diabetes by the Diabetes Education Program at the Hospital for Sick Children. This resource looks at screening for long-term complications for people living with Type 1 diabetes. Please note, the images in this resource are for illustrative purposes only and do not constitute the hospital's endorsement of a specific brand or product. If blood sugar levels are high for extended periods of time, people living with diabetes become more at risk for having damage to small and large blood vessels. You will not have control over some of the risk factors, but many can be managed to reduce complications. Risk factors include, but are not limited to, having consistently high blood sugar levels, length of time living with diabetes, smoking, having high blood pressure, hypertension, having high cholesterol and blood fats, dyslipidemia, being overweight, and being inactive. These risk factors can cause changes to heart vessels, circulation to the limbs, vision, kidney function, and nerve function. After having diabetes for a number of years, it is important that screening tests are done regularly to monitor any changes in these areas. Although it is rare to see complications in children and teens, ongoing monitoring is still important to identify any early changes that could occur and prevent further progression. Screening for complications. Screening tests for changes to heart vessels include measuring blood pressure. This test is done at least twice a year and checks for high blood pressure. Venipuncture, blood draw. This blood test is done during adolescence or sooner if risk factors are present. It checks for dyslipidemia, an abnormal level of cholesterol and fats in the blood. Screening tests to look at changes to the circulation to the limbs start in adult care if there are symptoms. Screening tests to look at changes in vision include eye checkups with an optometrist in your community. It is done yearly, starting at age 15 for teens who have had type 1 diabetes longer than 5 years. Screening tests to look at changes in kidney function include urine tests. They are done yearly, starting at age 12 in teens who have had type 1 diabetes for longer than 5 years. Screening tests to look at changes in nerve function include questions and a physical exam. These will help identify neuropathy or nerve damage during adolescence or sooner if symptoms are present. Screening for changes that can happen related to your diabetes is an important part of your ongoing care. Working with your team to try to maintain your A1C as close to target range as possible makes a difference and will help to keep you healthy. Diabetes research is ongoing, and future management innovations will continue to improve long-term health outcomes and the quality of life of those living with diabetes. We are here to help. If you have questions or need further tips, please contact your diabetes team.